CPR, or cardiopulmonary resuscitation, is a life-saving procedure performed when someone's heart stops beating. It's a combination of chest compressions and rescue breaths that help keep blood flowing to the brain and other vital organs. Imagine CPR as a bridge that keeps a person alive until medical professionals arrive. This bridge can be the difference between life and death, buying precious time for the person in need. CPR is not just for medical professionals. Anyone can learn this vital skill and potentially save a life. Remember, in an emergency situation, every second counts. Knowing when to perform CPR is crucial. Look for signs of cardiac arrest, a condition where the heart suddenly stops beating. If someone suddenly collapses, isn't breathing, or shows no signs of life, it's time to act fast. Other signs can include gasping for air, bluish skin color, and unresponsiveness. Time is of the essence in cardiac arrest. Every minute without CPR decreases the chances of survival. Don't hesitate to act if you suspect someone needs CPR. Remember, it's better to be safe than sorry. If you're unsure, it's always best to err on the side of caution and start CPR. Before starting CPR, check if the person is responsive. Gently tap their shoulder and shout, "Are you okay?" If there's no response, they might be unconscious. Next, check for breathing. Look for chest movements, listen for breath sounds, and feel for air on your cheek. If they're not breathing or only gasping, it's time to call for help. Immediately call 911 or your local emergency number. Early activation of emergency services is crucial for survival. While waiting for help to arrive, don't delay starting CPR. Remember, every second counts in a cardiac arrest situation. Chest compressions are a vital part of CPR. They help mimic the heart's pumping action and circulate blood to vital organs. Place the heel of one hand on the center of the person's chest, between the nipples. Place your other hand on top of the first hand, interlocking your fingers. Position your body directly over your hands, keeping your arms straight. Push down hard and fast, compressing the chest at least 2 inches deep. Aim for a rate of 100 to 120 compressions per minute. Continue giving chest compressions until help arrives or the person shows signs of life. Section 5. Breath of life, delivering rescue breaths. Along with chest compressions, rescue breaths are essential for delivering oxygen to the lungs. After 30 chest compressions, tilt the person's head back gently by lifting their chin. Pinch their nose closed using your index finger and thumb. Take a normal breath and seal your mouth over theirs, creating an airtight seal. Blow into their mouth for about 1 second, watching for their chest to rise. Give 2 rescue breaths, allowing the chest to fall between each breath. Continue cycles of 30 chest compressions followed by 2 rescue breaths. Section 6. Technology to the rescue. Using an AED. An AED, or automated external defibrillator, is a portable device that can deliver an electric shock to restart the heart. These devices are designed to be simple to use, even for someone with no medical training. They are commonly found in public places such as airports, shopping malls, and sports arenas, making them accessible in case of an emergency. If an AED is available, send someone to retrieve it while you continue CPR. Time is of the essence in these situations, and having an AED on hand can significantly increase the chances of survival. Make sure to keep performing chest compressions and rescue breaths until the AED arrives. Once the AED arrives, turn it on and follow the voice prompts. The device will guide you through each step, from attaching the pads to delivering the shock if necessary. The voice prompts are clear and easy to understand, ensuring that even a first-time user can operate the device effectively. Attach the AED pads to the person's bare chest, following the diagrams on the pads. Proper placement of the pads is crucial for the device to function correctly. The diagrams will show you exactly where to place each pad, usually one on the upper right side of the chest and the other on the lower left side. The AED will analyze the heart rhythm and determine if a shock is needed. This process only takes a few seconds, but it is vital to ensure that the shock is delivered at the right moment. The device will inform you if a shock is advised or if you should continue with CPR. If a shock is advised, make sure no one is touching the person and press the shock button. The AED will deliver a controlled electric shock to the heart, which can help to restore a normal rhythm. It is important to ensure that everyone stands clear to avoid accidental injury. Continue CPR as directed by the AED until medical professionals arrive. The AED will continue to monitor the heart rhythm and provide instructions. Keep following the prompts and performing CPR to give the person the best chance of survival until help arrives. Section 7. CPR in action, a real-life scenario. Imagine you're at a park on a sunny afternoon, enjoying a picnic with friends or family, and suddenly you witness someone collapse nearby. The scene is chaotic, and people around are in shock, unsure of what to do next. You rush over to the person who has collapsed. As you get closer, you notice they are unresponsive and not breathing. Panic might set in, but it's crucial to stay calm and act quickly. What do you do in this critical moment? The first step is to call 911 or your local emergency number immediately. This ensures that professional medical help is on the way. Clearly communicate the situation and your location to the dispatcher. After making the call, begin CPR without delay. Start with chest compressions. Place the heel of one hand in the center of the chest and place your other hand on top. Interlock your fingers and keep your arms straight. Push hard and fast in the center of the chest, at a rate of 100 to 120 compressions per minute. The depth of each compression should be about 2 inches. Remember, the goal is to keep blood circulating to vital organs. If you're trained in CPR and feel confident, you can add rescue breaths. After every 30 compressions, give 2 breaths. Tilt the person's head back slightly, lift their chin, and pinch their nose shut. Take a normal breath, cover their mouth with yours, and blow until you see their chest rise. Continue performing CPR, alternating between compressions and breaths if applicable, until emergency medical services arrive or the person starts to show signs of life such as moving or breathing on their own. It's a physically demanding process, but your efforts are crucial. Your quick thinking and CPR skills could be the difference between life and death for this person. Every second counts, and your actions can help sustain life until professional help takes over. Remember, in those critical moments, you are their lifeline. Stay calm, act decisively, and know that your intervention is invaluable until medical professionals arrive to take over. Section 8. The power of CPR, improving survival rates. CPR can significantly improve survival rates from cardiac arrest. When performed immediately, it can double or even triple a person's chances of survival. Studies have shown that bystander CPR, performed by someone at the scene, can dramatically increase the likelihood of a positive outcome. CPR helps keep blood flowing to vital organs, preventing irreversible brain damage and increasing the chances of successful resuscitation by medical professionals. Every second counts in cardiac arrest. By learning CPR and being prepared to act, you can become a vital link in the chain of survival. Section 9. Be the difference. The importance of CPR training. CPR, or cardiopulmonary resuscitation, is a critical life-saving technique that everyone should know. It involves chest compressions and rescue breaths to help maintain circulation and breathing in a person who has suffered cardiac arrest. Learning CPR is an empowering skill that can equip you to make a real difference in someone's life. Imagine being in a situation where someone suddenly collapses and stops breathing. Knowing CPR can give you the confidence and ability to act quickly and effectively, potentially saving their life. It's a valuable investment in your own safety and the well-being of your community. When more people are trained in CPR, the chances of survival for cardiac arrest victims increase significantly. This collective knowledge can create a safer environment for everyone. Numerous organizations offer CPR training courses, both in person and online. These courses are designed to be accessible and convenient, ensuring that everyone has the opportunity to learn this vital skill. Whether you prefer a classroom setting or the flexibility of online learning, there's an option for you. These courses provide hands-on practice and teach you the essential skills to perform CPR effectively. You'll learn the correct techniques for chest compressions and rescue breaths, as well as how to use an automated external defibrillator, AED. This practical experience is crucial for building confidence and competence. Consider getting certified in CPR. Certification not only validates your skills but also ensures that you are up to date with the latest guidelines and techniques. Many workplaces and organizations require CPR certification, making it a valuable addition to your qualifications. Having this certification can boost your confidence and demonstrate your commitment to being prepared for emergencies. It shows that you are ready to take action when needed, providing peace of mind to yourself and those around you. Remember, CPR is a skill that anyone can learn. Regardless of age or background, everyone can benefit from knowing how to perform CPR. It's a universal skill that transcends barriers and empowers individuals to make a difference. By taking the time to get trained, you could one day save a life, maybe even the life of someone you love. The impact of CPR training extends beyond the individual. It ripples through families, communities, and society as a whole. So take the step today and become a certified CPR provider. Your actions could be the difference between life and death.